Hey, my name's Adam. I'm going to be your nurse today. Good to see you.
Hi.
Wash my hands real quick before we get started. Alright, so I'm just going to go over what you've already answered before you came in here just to verify everything, alright?
Okay.
So your name is David, that's correct? 19-year-old male, and you're just here for a yearly checkup, is that correct?
Yep.
Awesome. You don't have any illnesses right now, feeling good,
Okay.
no medications, you're allergic to amoxicillin? Okay. Says you have ADHD. You answered you have ADHD, right? Okay, you don't take any medication for that? Good deal. Have not had the flu vaccination this year, but you have all your other vaccinations. You're all up to date? Okay. And then I got a long list here. I'll just go through. Hypertension, yes, no?
No.
Diabetes mellitus?
No.
Cancer?
No.
Myocardial infarction?
No.
Cerebrovascular accident?
No.
Tuberculosis?
No.
Autoimmune disease?
No.
Renal disease?
No.
Thyroid disease?
No.
Depression?
No.
Suicide?
No.
Alcoholism?
No.
Substance abuse?
No.
Where were you born?
Virginia.
Okay. And your education?
Just in high school or college.
Okay. And you are currently a student, right? Good deal. Okay, and you haven't had any recent weight change, weakness, fatigue, or fevers?
No.
Good. Alright. No rashes, lumps, sores, itching, dryness, color change, or anything on your skin, nothing unusual there? No headaches, head injuries, dizziness?
I have.
Any headache injuries?
Yes, I have.
What kind of injuries?
Concussion.
Okay. No vision changes, right? You wear corrective lenses? When was your last eye exam, do you remember?
2 years ago.
Okay. Any pain, redness, or excessive tearing in your eyes? Any double vision, blurred vision? You wear glasses? Reading glasses? Okay. Any change in your hearing? Any earaches or infections or any discharge coming from your ears? Good. Have you had any colds or congestion recently? No itching or any seasonal allergies? Seasonal allergies? Okay. Nosebleeds? No? Good. Alright. No gums in your mouth haven't been bleeding recently? Do you wear dentures? When was your last dental exam?
This year.
This year? This last summer? Okay. Sore tongue? Yes, no? Dry mouth? Sore throats or hoarseness?
No.
Alright. You notice any lumps or swollen glands on your neck? Any pain or stiffness? No? Alright. Any coughs recently? No? No difficulty breathing or wheezing? No pain when you're breathing? Any other kind of chest pains? Okay. Alright. Have you had any appetite changes? Any jaundice that you've noticed in your skin or eyes? Any nausea? Heartburn? Pain? Any changes in your belching habits? Change in bowel habits? Good. No diarrhea? Are you allergic to any foods? Wonderful. Have you noticed a change in your urinary frequency? No pain when urinating? Okay. It says you're not sexually active, that's correct? Good. No unusual discharge or sores on your penis? Okay. Any clotting in your legs or leg cramps or varicose veins? No. Muscle or joint pain or joint stiffness? It says you have had some back pain or some knee pain. Is that from something specific?
Athletics.
Athletics, okay. Do you have any seizures or weakness or paralysis, numbness and tingling? Nothing like that? Good. Do you have a history of anemia? Do you bruise easily? Get any blood transfusions?
No.
None? Do you have a hot or cold intolerance? Do you excessively sweat? No? Have you noticed a glove or shoe size change recently?
No.
Awesome. And any anxiety, depression, memory changes, or suicidal attempts or thoughts recently? Good deal. Alright, so we'll get this assessment going then. I'm going to start by taking your vitals. It says you are 165 pounds, 5'11", with a BMI of 23, correct? Alright. I'm going to check your pulse now real quick. Let me just have your wrist. All right. Pulse was 56 and your respirations were 16, so that's all normal. Your rhythm was regular and you had a nice strong pulse, so that's good. Take your blood pressure real quick. Just want to stick your arm straight out for me here. And turn it. Perfect. Got you at 100 over 58. That's a good blood pressure, especially for an athlete. All right. Have you had any fever symptoms lately? Any chills? Nothing?
No.
Good deal. And you have any? And you said you had some back pain earlier.
Mm-hmm.
If you could rate that on a scale of 1 to 10, 1 being no pain, 10 being the worst pain, what would you rate it?
Like a 4.
Like a 4. Okay. All right. I'm just gonna assess your hands and skin on your hands real quick. Just make sure everything feels good. Any pain or tenderness as I'm touching here? Mm-hmm. Nothing. Good deal. No stiffness in the wrists or joints or anything? Mm-hmm. Awesome. Capillary refill looks good. Hands are nice and moist. All right, if you could smile for me and frown. Awesome. Facial expressions are all symmetrical, which means your cranial nerve is looking good. All right, let me just check your hair and your scalp real quick. Just make sure everything up here looks good. Doesn't look like there's any dandruff. You deal with dandruff often? That's good. All right. Can you open and close your mouth for me? Awesome. No popping in there anywhere. Wonderful. Okay, now let me just feel your lymph nodes in here. Open your mouth again real quick. Perfect. And go ahead and close it. Awesome. Any of that tender, any pain anywhere? Mm-hmm. Good deal. All right. I'm going to check your eyes real quick. I'm just going to use my light. Just go ahead and look straight ahead at that back wall for me. Good deal. Awesome. Now look at my pen. And look at that back wall. And back at my pen. Now follow it where it goes. Perfect. Eyes all look good there. Didn't look like you had any discoloration in your eyes. Pupils reacted all well, so that's all good and fine. All right, now if you could just step right over here. All the way over here. I'm going to have you read this Snellen chart for me. Perfect. Now close your right eye and read as far down as you can.
Just take a line.
Yep, just as far down as you can see.
FELOPZD.
Perfect. Now close your other eye and do the same thing.
BEFPOTEC.
Wonderful. Okay, you can come back and sit down. All right. I'll take a look at your ears here real quick. Just let me know if there's any pain or tenderness around them. Good. Over there. All right. Now, can you hear my fingers?
Mm-hmm.
Awesome. And this side too?
Mm-hmm.
Good deal. Okay, now can you close one nostril and then breathe through the other one for me? And same thing over here. Good deal. Septum looks in line, no deviations there, so it all looks good. All right, now can you swallow for me real quick? Good, and stick your tongue out and move it around for me. Awesome. Cranial nerves looking good still. All right, now if you could just open your mouth for me, I'm just going to look in there, make sure everything looks all right. Good, gums look nice and colored, got all your teeth, and stick out your tongue for me so I can see the back of your throat. Awesome, doesn't look like there's anything going on back there. Okay. Now push against my shoulder, or my hands real quick, just with your shoulders. Good. And with your head. And same thing here. Wonderful. Find your pulse. Good deal. Any tenderness or swelling in here? Good. You didn't have any pain or any problems recently with your neck? Wonderful. All right, now I'm just going to listen to your lungs real quick. So just breathe normally for me. All right, breathe in nice and deep. And out. And same thing. And again. 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 And last time. All right, same thing on the back here. Breathe in and out. And again. And again. One more. And again. And last one. Excellent. Everything sounds good. You don't have any problems with asthma or breathing, right? Wonderful. All right. Breathing sounds looks good there. Okay, I'm just going to palpate your chest a little bit. Let me know if you feel any pain anywhere. All good there? Good. Let me check the back real quick. Everything good back there? Good deal. I'm not feeling any lumps, so that's good. Skin's nice and smooth. Alright, I'm going to test your range of motion and your strength for your upper extremities real quick. So just hold your arms out like that for me and push up against them and down. Now hold them straight in front of you. Now try to make them go out. Good, and back in. Good. Now just follow me. Just go up around with your shoulders here. Good, and back forward. And then bend the elbows. And we go out and up with the shoulders. Fingers and hands all look good. And then neck side to side. Wonderful. Hold your arms like that for me. Now pull against me. Sorry, pull up. Good. And down. Good. And same thing with your wrist. And down. Good deal. And with your fingers, try to spread them. Try to spread your fingers. Good. All right. Veins in your neck look good, not distended. No problems there. All right. Now, if you could lay down for me, let me drop this down so you could lay down. There we go. And I'll pull this out so you're straightening on it. Good. I'm just going to listen to your heart. So just breathe normal. All right. Everything in your heart sounded good. Your apical pulse was 58. All right, I'm just going to listen to your abdomen here. Going to move your arms to the side. Just going to palpate around. Let me know if anything hurts or any pain anywhere. Good. I'm just going to look and make sure. No discoloration. Alright, I'll have you sit back up again. That was sounding good. Very active. Did you eat recently?
Oh, yeah.
Yeah? Alright, let's just back in. Alright, and there was no pain or anything when I was palpating your abdomen? Nope, good deal. Okay. Alright, you can go and take your shoes and socks off for me. I'm just going to look at your lower extremities. Just let me know if any of this hurts anywhere. Veins all look good. Good pulse there. Good pulses on your feet. Okay. All feels good? Good deal. Skin all looks good. Pulses were palpable on both sides. Okay. So I'm just going to check your range or your strength on your ankles here. So just push up against my hands. Good. And down. And out with your ankles. And back in. Now push up with your knees. And pull down with your knees. Good deal. Now close your eyes and have you tell me if these are light or soft or sharp that I'm poking you with, okay?
Right.
Sharp or smooth.
Okay, sharp or smooth.
Ready?
Sharp.
Okay.
Smooth. 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 Sharp. Sharp. Smooth. Smooth.
Wonderful. All right. Now, can you touch your right heel to your left shin for me? And same thing with the other way. Good deal. And stand up for me. And go with your arms out and just touch one hand to your nose and other one. And then just follow my pin. Good deal. Sit back down. Okay. Now close your eyes, and I'm just going to move your finger, and I just want you to tell me if I'm moving it up, down, right, or left, okay?
Up. Left. Up. Down. Up. Down. Right. Left. Up. Down. Right. Up. Up. Left. Right. Down.
Good. All right, last thing here, then I'll have you put your shoes back on. Just lift your legs up for me real quick. I'll rest them back on the side. Just going to check your reflexes down here. Good. Good. All right. Now, I'm not going to check the rest of your reflexes, but if I was going to, I'd check your tricep reflex by holding your arm here. And just go limp. I'll hold your arm up. And I'd hit you here, and your reflex would be that. Your bicep reflex would be here, and I'd hold your arm, hit you here, and would go up. Brachial radialis, you rest your arm on your leg, hit you here, and your wrist would flinch. Patellar reflex is down here on your knee, and I would hit you here, and your leg would come up, and your Achilles reflex is down here. I'd hit you back on your Achilles, and your foot would pop. But I'm not going to do that for you today. You can go ahead and put your shoes and socks back on. Alright, now if you stand here and just walk to the end of that colored tile, you see that? Just like normal, heel toe. Perfect. And then walk back on your heels. And then back there on your toes. And then walk back, just normal. Alright, now bend down and touch your toes.
I can bend over.
Yep, I'm just going to check your spine real quick. Okay, now come back up. Good, good range of motion there. Okay. And then just stand on one leg and kind of bend your knee just a little bit and back up. And same thing on the other side. Perfect. Alright, now close your eyes. I'm just going to have you stand there. Make sure you can stand without swaying. And I'm just going to push on you, just like fall over. Good deal. Alright, you can go ahead and sit back down now. All right. Well, that is everything that I have for you today. Do you have any questions for me?
No.
All righty. Well, thank you very much. I appreciate your time. And I hope you will.
Thank you.
Mm-hmm.